This week on Healthy Living, what is fistula and how serious is it? We'll take an in-depth look at the debilitating medical condition. Nigerian reproductive health expert Dr. Yelwa Usman discusses the causes of fistula and how it's being addressed. And a breast milk bank in Mozambique brings relief to new mothers and their babies. Plus, a startup in Ghana promotes diversity in cancer research. We'll have these stories and more on this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us on Healthy Living. Obstetric fistula is one of the most devastating and serious of childbirth injuries. An obstetric fistula occurs when a mother has a prolonged, obstructed labor but does not have access to emergency medical care such as C-section. The World Health Organization estimates that there are 50,000 to 100,000 new cases of fistula every year. At least 1 million women in Africa and Asia are currently suffering from untreated fistula, according to the Fistula Foundation. Observers say obstetric fistulas are often left unaddressed in low-income countries due to lack of obstetric care. Women who suffer from fistula cannot control their urine or feces and live with incontinence and in shame. Sadly, they are often shunned by their communities. In Mozambique, more and more women are being diagnosed with obstetric fistula. The health sector fears the number of registered cases could get to 4,000 women with this type of injury every year. Adina Swalehe reports from Nampula.
Obstetric fistula is a debilitating rupture in the vaginal canal caused when a mother has a prolonged and obstructed labor without being properly assisted by healthcare professionals. Here in the province of Nampula in Mozambique, some women with the condition recently went through correction surgery at Nampula Central Hospital as part of a campaign by the Focus Fistula organization in the health sector.
I can't control my urine. My bladder hurts. I came here to the Central Hospital and I have faith that I will recover. I ask God to accompany me.
I was pregnant, and on the day of my delivery, I came here to the hospital and had an operation. But I lost the baby. Now I am left with bladder pain and I cannot control my urine.
Urologist Igor Vaz, a fistula surgeon and founder of Focus Fistula, says the rise of obstetric fistula cases in Mozambique may be because there's more awareness of the condition and consequently more women seeking treatment. But he also says it could point to a decline in the quality of health services provided to expecting mothers in the country.
Fistulas can be very complicated, but most cases can be treated, and women can go back to their normal lives. I would like to ask people not to miss the opportunity to get a treatment. We have been operating fistulas for many years, and today we could fix some cases in this province. The latest data, which are still being collected and are not official, show that we have over 2,000 registered cases of fistulas per year. We fear the number might even reach 4,000 cases.
The official data from the health sector in Mozambique point to the provinces of Nampula and Niassa have highest number of fistula cases. Besides the pain and the injury caused by childbirth, some women lose their babies during labor and say they are then shamed by their partners and ostracized by their communities.
Dr. Yelwa Usman is a reproductive expert at the Maternal Hospital in Abuja, Nigeria. She tells us more about fistula and what is being done to address it.
There are different types of fistulas. We have, depending on the location. One we have in Africa is the obstetric fistula. That means the fistula that happens due to injury during childbearing. The fistula can be caused due to violence, rape. Those at risk are those women and girls who will not have access to quality health services. This issue of girls' marriage, early marriage, is something that is very sensitive and important to discuss. So if the girl is not matured enough, her body, her pelvis is not strong enough, so there is that risk. Reconstructive treatment, surgery is available. You have the non-invasive treatment, and also you have the major surgical treatment. But there is need for the reintegration of those women, because those who have fistula are abandoned by their husbands. They feel they are stigmatized in their communities. They don't even get jobs. They can have the depression, and they deep go into poverty. So there is need for a holistic approach to that. When we talk of prevention, it also needs a holistic approach. One, we have to raise the awareness. Every year, according to the World Health Organization, 50 to 100,000 new cases are discovered. And what the most painful part of it is that Nigeria will contribute 40% of the worldwide cases. Some may even live with it forever. They can even die before getting to the stage of the treatment because of the queue, because the load is becoming more, and getting to the treatment is slow. And 2016, the UN Secretary General made a declaration that there is need for the world to support ending fistula. So we are hoping that by 2030, fistula will come to an end.
South Africa's health regulator has reported a causal link between the death of an individual and Johnson & Johnson's COVID-19 vaccine. This is the first time such a direct link has been made in the country. Senior scientists say the person presented with the rare neurological disorder Guillain-Barré syndrome soon after being given the J&J Janssen vaccine and later died after being on a ventilator. Europe's medicines regulator last year added Guillain-Barré syndrome as a possible side effect of AstraZeneca's COVID vaccine, which, like J&J's, uses viral vector technology. J&J said in a statement that GBS, Guillain-Barré syndrome, was associated with the administration of various vaccines and other medicines and can be triggered by SARS-CoV-2, the virus that causes COVID-19. Health experts recommend vaccination to protect against COVID-19 and add that the benefits outweigh the risks. Breast milk is a source of nutrition for babies, but not every mother can produce their own milk. In order to ensure that newborns, especially premature babies whose mothers have difficulty breastfeeding, have access to this, the Maputo Central Hospital in Mozambique created the Maternal Milk Bank. It's the only one in the country. We have more on this, so let's take a look.
Here at the Maputo Central Hospital is the first and only breast milk bank in Mozambique, created to meet the growing demand of breast milk for premature newborns. The milk donated here is given to babies whose mothers do not produce enough of their own milk or who are unable to breastfeed. Yolanda Langa has been donating her breast milk for over a month. Despite her busy work routine, she is always trying to find time to help.
I know how important milk is for a newborn. It's something that only we, mothers, can give, and I felt compelled to come and donate milk to babies who are in need, possibly because their mothers may have died or have insufficient milk production.
She says she feels a sense of pride and relief being able to nurture other children besides her own, and invites other lactating mothers to join the cause.
I hope they come here and donate because it's something we constantly produce, and there are a lot of mothers who end up not being able to breastfeed for one reason or another. It is a precious liquid that could save a child's life, so let's donate it. It doesn't hurt, and the more we donate, the better.
The specialists here say there are certain requirements that must be met for the donation.
Primeiro tem que ser alguém que esteja a amamentar.
First, the donor must be breastfeeding. She must have a baby and be breastfeeding. She must have been tested, and the test results must be negative for HIV, hepatitis B, and syphilis. These are the 3 mandatory tests and must be done before starting the milk donation.
Madalena Balati, a nutritionist at the Milk Bank in Maputo Central Hospital, explains how the process works.
When the milk arrives from the donors, we bring it to this room where the pasteurization takes place. Pasteurization is a process of eliminating any bacteria and viruses by heating it up to 62.5 degrees Celsius for 45 minutes. Then we taste the milk to make sure it's suitable for consumption.
Workers here say during the coronavirus pandemic, donations dropped because some mothers were afraid to go to the hospital. So they started a home collection service.
No lugar das doadoras virem até aqui ao banco de leite.
Instead of donors coming here to the milk bank to donate milk, we go to their homes. We create a schedule based on their availability and then go out at the scheduled time to collect the milk.
The director of the milk bank says on average they collect about 25 liters per month.
A startup in Ghana is focusing on diversifying cancer research to include more African and African American people to help develop better treatments. The WHO reports that 70% of deaths due to cancer occur in low and middle income countries. Let's look inside one of the only laboratories in Ghana equipped for molecular analysis to find out more.
Yamachi Biotech is a research and diagnostics startup in Accra, Ghana. Dr. Akakpo is a pathologist at the facility and says he thinks this lab could change African cancer studies forever.
Even though breast cancer has been studied extensively throughout the world, the truth is that most of the cases are not Africans. If you look at every study across the world, there are very few of them who are Africans. So what this does is that you come to the African population and study it, and that has effects on African Americans and any other group that has a basis in Africa. That's why this is so important. Without it, you don't have enough to relate to African breast cancer.
It's difficult to find and collect accurate data on cancer in Africa, but research by the U.S. Department of Health and Human Services shows only about 2% of genomic study participants are of African descent.
We have one of the world's fastest growing burdens of cancer, and we have some of the highest cancer mortality rates anywhere in the world. So as much as HIV and malaria are problems, cancer is a huge problem, and it's actually a problem that is growing faster than those other problems. So I felt that for a new company starting out, we needed to focus on an area that was really important, but also was less traveled.
Yamachi's Ghanaian founders have created a laboratory equipped for molecular analysis, and researchers can collect data they say will aid the development of precision medicine for cancer patients in Africa and throughout the diaspora.
Treatment of cancer is not always going to be in the clinic, but treatment of cancer is going to be in the lab. Most treatments were started on a lab table, and if we need to find a cure, if we need to race for a cure in Africa for Africans, then we have to start it here.
The company has also made a testing kit for human papillomavirus, or HPV, that people can use at home. Research shows that infections like HPV increase the risk for liver cancer and cervical cancer. The American Cancer Society estimates more than a third of global cervical cancer deaths occur in Africa.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voanews.com. Be sure to follow me on Twitter at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.